Good evening, everybody, and welcome back to another episode of Straight Talk with Dr. Lisa. We talk to you about your health and we give it to you straight, no chaser. I'm so happy to be here today with two very special guests. And I'm excited because today we're going to mix it up a little bit and we're going to entertain you a little bit. So stick around, put your questions in the chat. And at the end of the half hour, you are going to be treated to some musical entertainment. But before we focus on that, I want to introduce you to two what I'm calling public health icons. And you'll hear about why I'm considering them public health icons. We have Dr. Olajide Williams and Darryl DMC McDaniels. Welcome to the show today, gentlemen.
How you doing?
Thank you for having us.
Thanks for having us.
So you all are here. We wanted you to be here because of your organization, Hip Hop Public Health. But I want people to hear from you. Who are you, first of all? And then why did you start this organization? So let's start with you, Doctor.
Sure.
Tell us about you and why you started Hip Hop Public Health.
Sure. So I'm a physician. I've been practicing medicine since 1994. I specialized in stroke, and I'm currently the chief of staff of neurology at Columbia University. I see patients. I also run a lot of research projects, and my specific focus of the last 20 years of my academic career has been in health disparities research. And so, one of the things that I realized very, very early on, I was chief of the stroke center at Harlem Hospital in Central Harlem many years ago, probably about 16, 17 years ago, when I was running the stroke center at Harlem Hospital, and we were working very closely with the Central Harlem community back then. And one of the things that was clear to me was that we really needed more innovation in the way we address public health communication to that particular community. That was the Harlem community at the time. Public health messages were just not penetrating. I also graduated from the Columbia's Mailman School of Public Health, and I just realized that these public health messages weren't reaching the community that I was serving. And the youth that I was serving and the youth that I was working with just weren't hearing the messages. And, we all talk about the social determinants, and, we can speak we can gobble up your whole show talking about social determinants and structural racism. But one of the simple things that I realized was really missing was the way we spoke to our communities, especially the way we spoke to our youth of color in our communities. And so I got together with a group of young people at Harlem, and I said, look, how do you want to hear this message? How can we get you to pay attention? How can we get you to listen? What can we do to help you? So we got together some of the, this incredible young people, real leaders, peer leaders, a lot of, they had a lot of social capital in Harlem back then. And they said, look, if you want to speak to us and you want to get us excited, we love hip hop. And if you can use hip hop to speak to us, then, we're in. And I was like, oh man, how am I going to do this? What do I know about hip hop? I'm a neurologist. I love hip hop. I've been listening to hip hop since I was born. But what do I know about creating a program, a health program around hip hop? So, long and short of the story, I was able to track down Dougie Fresh. And so I tracked down Dougie Fresh, and we had it took me 6 months to track him down, but
I was gonna say, how hard or easy was it to get him? Look, you just sent him an email, or what did you do?
Look, so what I did, I was running the electrophysiological lab.
What is that, doctor? That's one thing we do on Straight Talk is we don't use those big doctor words. So
that's what I love. So it's basically it's a procedure where we test your nerves. You come into my lab and I figure out whether your nerves are damaged or your nerves are good.
Okay, great.
And so this young guy, actually he was probably in his mid 40s, was sitting in my waiting room, and he had his headphones on, and he was just like, he was dancing in the waiting room, and then he started beatboxing. And I was
In the
walking out,
waiting room.
he was beatboxing. So I was walking towards my lab and I heard him beatboxing. I was like, man, this guy's good. And I love hip hop and I love beatbox. I'm a real hip hop connoisseur. And so I was listening to him beatboxing and I was like so impressed. So he came into my lab and I said, man, you're really good. And he said, well, that's because I learned from the best. And I was like, nah, don't tell me you learned from Dougie himself. And he goes, yeah, I learned from Dougie himself. So his name was Richie Rich. And he was part of a group called Captain Rock back in the 80s. And you know Captain Rock D, right?
Yep.
And Richie learned his craft from Doug. So I said, well, I'm thinking about doing the stroke thing. Can you connect me to Doug? So he goes, yeah, he goes, I got you, Doc. I'll connect you. So I gave him the greatest service known to man that day. And then he comes back and he says, I'll connect you to the Doug's manager. So I called Doug's manager and I speak to Doug's manager. I say, hey, Mary, I said, I want to speak to Dougie Fresh. She goes, who are you? I said, well, I'm Dr. Williams. I'm running the stroke center at Harlem and I want to speak to Dougie Fresh. She goes, what do you want to speak to him about? So I said, I want Dougie to write raps about stroke for the kids in Harlem. And so she was like, yo, so what's your budget? That sounds cool. What's your budget? And I said, well, I don't have a budget. And she goes, well, call me back when you have a budget. And so I said, oh man. So
wow.
I try to scrape around for some money. I couldn't get any money. Everybody thought my idea was crazy. And they were like, that's crazy. We can't fund that. So I just kept calling. And 6 months later, Mary said, you know what? Just for your resilience, I'm going to connect you to Doug. So I connected to Doug. Doug and I started the organization. We founded it together. We hit it off real cool. Doug's got a big heart. We started it together, and Doug basically called D. He called Chuck D. He called DMC. He called all his friends to join us, and now they're all on our advisory board, and they all help us with the hip hop piece, and me and my team help with the health piece. That's why public health.
I absolutely love that story, but did they teach you to rap? And are you also going to rap for us today?
Well, look, I am not going to rap because
he's in the video rapping, though.
But I am in one of the videos rapping,
Yes.
Yeah, all right.
Doc doesn't just stand around in the studio. The fact that he's here just because he's a doctor doesn't mean he can't come get on the mic for awesome. a couple of bars. Right.
So, Darryl, why don't you tell us about yourself and your role in hip hop public health, and then we're going to show one of these clips.
Yeah. Well, from day one, as everybody know, when it comes to my group Run DMC, we was always focused on giving out good ideas, concepts, and images to inspire, motivate, and educate the people that heard our records. Although it was fun, we always knew that now that we got them listening, we can put in positive, life-saving, educational, informational pieces into our music that would help save someone, educate a life, give people options and alternatives that were stuck in the communities that our music is dominant in. From little things such as, when we first came along, everybody's perception of hip hop was that it was about death, depression, despair, and destruction. It came out of those things. But we also knew that, in the dirt poor ghetto, there is beauty. In the dirt poor ghetto, there is knowledge and education and positivity. But that being said, it's hard. I'm not a preacher. I ain't no politician. I'm not a parent. I'm none of the 3 Ps. So there's a slight chance these people won't listen to me. But if I put those ideas, concepts, and images to a beat, at least they'll stop and give me a look. So from day one, Run DMC was always about, be cool, go to school. When I first made my first record, I just rapped, I'm DMC in the place to be. I go to St. John's University. And since kindergarten, I acquired the knowledge. After 12th grade, I went straight to college. And I just said that on a record. Because I put that information out there, the young people and all the people across the world that was listening to my music, they realized, you can go to school, you could get a diploma, you could go to college. And people started not joining the gangs. People start not selling the drug. DMC, he said it's cool to go to school, so I'm going to go to school. So just those little things. I always rapped about family. I got one of the greatest records in the history of hip hop, and it's basically about Christmas. It's Christmas time in Hollis, Queens. Mom's cooking chicken and collard greens, rice and stuffing, macaroni and cheese, and Santa put gifts under Christmas trees, decorate the house. So I was always rhyming about family and stuff like that, and it was educating and informative to people. So that being said, Run DMC's track list of records, from My Adidas to It's Like That to Hard Times to Together Forever. It was always about be cool, go to school, don't mess with drugs and thugs, and you can still be cool. DMC in a place to be. I wear my glasses so I can see. So there was always healthy stuff there. If your eyes is bad, you can wear glasses like DMC to correct your vision and still be cool. So that being said, Dr. Williams and Dougie, they formed this wonderful organization to do with direct intent in certain communities and certain demographics of our culture, what hip hop was already doing. But now he's going to attack certain issues of health. So basically they just called me up and was like, I got Dougie Fresh, he's doing it. And once I heard Dougie was down, I'm like, I'm in there. I'm like, who else you got? Yeah. Chuck D. Once he told me Chuck D, a Public Enemy, he's like my idol. And when it comes to information, to battle misinformation and conspiracy theories and historic history and education and everything about the communities where we all come from, Chuck D, he's the god of all of this.
Well, so I would say this is a great segue to what we want to talk about, which is related to how you all were activated. You activated yourselves during the pandemic to help address all this COVID misinformation about vaccines. So we want to show a clip from one of those videos you all, or one of those raps you created during the pandemic. But before we show that, I just want to welcome everybody who's joined us since we started this conversation. It's a great, fascinating conversation with these creative geniuses, Dr. Olajide Williams and Darryl DMC, who have been using their talent as a physician, scientist, and then hip hop artist to educate people during the pandemic. So if you have questions, go ahead and put them in the comment section, and maybe we'll get some of your questions answered from these two. So why don't we show the first one so people can get a flavor of what you guys were up to during the pandemic. And then we'll got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. Alright, there is none higher. DMC, I will inspire. Time for us to trust and not debate. The vaccine, believe it's safe to take. 9 out of 10 people won't get sick. That's 90% effective and legit. This COVID thing is real and it will find you. It's killing our people, let me remind you. Back in the days, there was polio, smallpox, back in the days. Measles and mumps, man, back in the days. But because of the vaccines, none of those stays. Vaccines, they work to trigger immunity. 2 shots, we got antibody security. We gotta act now, no need to wait. Get your vaccine before it's too late, for real. Okay, that was awesome. We have one more. We'll play it a little bit later, but first, let's just jump in and talk about how did the community respond to those messages? Did you feel like you addressed misinformation?
Well, it's not. It's they're supposed to be conversation starters, and so that there
Mm-hmm.
are five of these. The first one is to start a conversation about what vaccines are. That's why we have in there how vaccines were used for polio and smallpox to start those. The second one is about is are vaccines safe and how do you know this? I know you're going to show that later, and that mentions Tuskegee and eugenics, etc. The third one talks about some of the common myths and misperceptions. The fourth one talks about, what do I expect if I take the vaccine? What are the side effects? And the fifth one really talks about what is herd immunity, which is what we call community immunity. Why is getting the vaccine better than getting COVID? And so that's supposed to be conversation starters. And so the way we've been using them within our town halls. Dee and I do a lot of town halls. We partner with the Ad Council. We partner with different media outlets. We have a whole institute of community health workers that I run across New York City, and so they're used as conversation starters. And then with those, it gets people interested. It gets people asking questions, and then you come in, and then you have really honest conversations about what your fears and what your concerns are, what your anxiety is. And that's really what they're designed to do, is to really open the door and start moving that conversation forward. There is no single bullet. I'm a behavioral scientist. There's no single bullet that you're going to put out a record and it's just going to change people's minds overnight. That doesn't. It's to start those conversations and take people on a journey where they feel more comfortable about the vaccine. And there's some people that it's worked on. There are a lot of people that have reached out and said, because of our initiative, which is a packaged initiative, not just individual videos. Because of our initiatives, people have decided to get the vaccine. And then there's some people who say, look, I'm not feeling it. I'm not getting the vaccine. But our goal is just to continue to push the issue, knowing that we're not going to win everybody, but even if we can win one or two people, we're saving lives by doing it.
Yeah, and Darryl, have you been out in the community rapping with people in both the literal and the figurative sense? So, what are you hearing, and how do you think the videos are resonating?
I think the important thing is the videos are getting people's attention. And like Doc said, all we can do is fight fear and anxiety and misinformation with facts. Now, that being said, that's easier said than done. But, it's getting a lot of attention. I got people, I get a lot of hate mail because I'm saying, get the vaccine, this
really?
and that. Yeah, because you got to understand, some people do have a right. If you look at the Tuskegee experiments, that you're afraid, but along with Tuskegee, they're going to put a chip in you. They're going to turn you into a zombie. It's like, people go on the internet, people watch too many movies, and people believe everything they read on social media. And, for me, it's a thing where, I get mail like, you selling out. Why are you jumping on this? And just because of all the conspiracy theories and some people that will just say, D, what about this Tuskegee thing? They have a right to do that. But my strength, my role in here is people need to understand. They need the voices, and they need the journalists and the reporters and people who can start, like Dr. Williams said, dialogue and conversations about these issues, whether it's good or bad. Once we get their attention, now there's a chance we can educate, inform, and then change behavior. But that only happens if you give people understanding. So as opposed to me telling people, just go listen to the, the PSA I did, I can share and create understanding by my example. And one of the examples that I use, Dr. Lisa, is about 8 years ago, I had to go over to South Sudan to perform, right? Yeah, which was crazy. So In order for me to go over there and stay healthy and protect myself against whatever virus and germ was over there, I didn't have to get 1 or 2 shots. I had to get 7 shots. So I showed people
Been
like
there,
this.
done that, yes.
Yes, I had to get 7 shots to go over to a place where there was viruses and disease to protect myself. And I shut everybody up. No, I ain't getting that vaccine. They trying to kill black people, this and that. I said, yo, I had to go get 7 shots to go over someplace where there was virus. I said, a virus has come to our nation in our backyard. So you mean to tell me you're not going to get a shot to not only protect you because the virus is here, but also to protect others? And when I say it like that, just pause for a minute. Because, a lot of people are really selfish. There's people that I respected over the years, but to hear someone say, we are supported by scientific medical professionals who would not be telling people to go get a vaccine if it was going to harm them. I would not be sitting here with Dr. Williams if Chuck D wasn't involved with that. Has Public Enemy ever associated themselves with anything that would harm our black? No, we trying to uplift the black folk and keep them healthy. So on that note, my presence here, deeper than me being, I'm just a voice piece for the doctor and the scientist trying to save lives. But in addition to that, what's beautiful about me, it's not the great DMC I'm gonna do it because DMC and I love him. The great thing people should believe in me is I'm getting my information from the source. Yeah. Dr. Williams informed me, it's the conspiracy theories and it's against the black people. But Dr. Williams and other doctors and professionals informed me that it was a black lady who was at the forefront of getting this virus for us in the first place. A black lady.
Getting the vaccine.
Developing the vaccine. So if you educate these young people and the older people now, especially if you educate our so-called hip-hop community, because it's a lot of us, the young people that we educate and inform now will grow up into healthy adults who have changed their behaviors to not only protect themselves from the vaccines, but the million other things Dr. Williams thought we're fighting against: obesity, mental health, high blood pressure, all of these things. So if a man in a team, in an organization that was already doing that, helping to inform and educate, don't you think the PSAs, instead of telling you get the vaccine, would be don't get the vaccine? The beats would be harder. We'd probably have more out if it was detrimental to the survival of our people.
Yeah, let's talk a little bit about the science. I think this is really important, Dr. Williams, because I think, sometimes we like to bucket things and we say, well, the science is over here and the fun is over here, and you've managed to combine them. And I understand you've conducted some research to show that using hip hop music, you can shift people toward different behaviors, healthier behaviors. So tell us just briefly about your research and what you found.
Sure. So I'll just talk about 2 studies that we did. The first study we did was a stroke intervention in New York City. So stroke is a disease for which we have what we call time-dependent treatment, which means that we need to treat you within 4.5 hours with a medication we put in your veins, or we can treat you with another procedure where we actually go in. We would catheterize you and we would pull out the clot from the artery in your brain. So, but all of these treatments can only be given within a very small time window. What we were seeing in Harlem was that this is about 15 years ago, was that people were arriving too late for the treatment. People were arriving the next day. People were arriving outside of that treatment. We were only treating about 2% of potentially eligible patients. Imagine that, 2% we were only treating. And the number one reason why we were only treating 2% was because people were not coming in on time. And the reasons why people weren't coming in on time was there were several reasons, but the main one is, one, they didn't really recognize the symptoms that were occurring as urgent and dangerous. And a lot of folks would try to sleep it off. Oh, my leg fell asleep. I can't move my leg. And they'll try to sleep it off. I can't speak. I'm slurring my words. I'm going to take an aspirin and try to sleep. And they wouldn't come to the emergency room to get the treatments that we had available to them. And so what we decided to do was to cut a long story short. My hypothesis was that my belief, what I wanted to test was whether we could train children who are a captive audience and we could reach them in the schools to teach their parents and their grandparents in their homes about the signs and symptoms of stroke, so they know how to recognize the stroke, teach them about calling 911 if they even sniff these symptoms, and teach them that the symptoms are reversible if they could make it to potentially reversible if they could make it to the hospital really early. That golden hour, that first hour is what we call the golden hour. And so we basically created a hip hop intervention that did those things, taught the signs and symptoms of stroke so that people know how to recognize it when it's happening, taught them that this is what you do when it happens, you call 911, and then teach them that, and if you do this, you have a chance of fully recovering from your symptoms if you get this medication. And so we created these modules. There were 3 modules. It was a mini curriculum that we delivered across every single school in Harlem. And we could get to the schools because Harlem Hospital was running all the school-based clinics in the entire community. And then what we did, we first saw that this was a really potentially powerful way, because we saw that these kids, that the parents actually, we created a measure that measured the ability of a parent or a grandparent to recognize the symptoms and through hypothetical scenarios to make the right decision. And so once we saw that this was a potentially powerful way to get this knowledge into the community, we decided that we'll do it on a mass scale. So we ended up recruiting about 4,000 families.
Wow.
We randomized, yes, children and their parents and grandparents, and we randomized them. So basically when you flip a coin, one of them will go into the intervention, the hip hop arm, and then the other one will go into what we called an attention.
Like vaccine trials.
Yeah, so this is, exactly. And so what we found at the end of this study, this is just a stroke study, that first of all, the parents and the grandparents, their stroke literacy increased tremendously. Secondly, we were able to reduce the arrival time in our emergency room among those who received the intervention. And thirdly, we had a whole bunch of kids calling 911 for stroke. And then finally, we quadrupled our treatment rates with the stroke medicine in the intervention arm. And so it was a very positive, and we published our findings in multiple, we've had like 10 publications on this. And then I decided that, well, this is not about stroke. This is about behavior change. This is a model that we could take to and use other content areas. And so then we put it in, we got into the nutrition space. And then we started developing similar interventions around obesity and nutrition and physical activity. And we showed even there that we were able to influence food purchasing behaviors of children and their families that received the hip hop intervention. And then they were able to sustain those behaviors over a few weeks. And then we said, well, there's what we call it's a triangular relapse pattern in public health, where you kind of respond to the behavior right after you receive the intervention, and then you go back to normal because all the forces around you are just going to bring you back to normal. The environment, the fast food restaurants, you just go backwards, right? And so it's important for us to also do environmental re-engineering, bringing those healthier options, make it more affordable, all the things that it's beyond the power of physicians alone to do. And but what we did realize was that, wow, hip hop really has great potential in changing behavior. And that's really how Hip Hop Public Health was born. We're in an evidence-driven organization that we use the science of behavior change to develop these programs and interventions to move a particular health behavior. or to move health knowledge about a particular issue.
But it sounds like what you're saying is hip hop saved lives.
That's what I'm talking about.
That's
pretty incredible.
Yes.
And the work you're doing during the pandemic, I think, is also illustrates that as well. So we have another video we want to show. And for those of you who are just joining us, please put your questions in the comments. We're going to go a bit longer tonight. We have another doctor joining us because we are talking about hip hop public health, but we also want to answer your questions tonight, particularly about the Johnson & Johnson vaccine. And so Dr. Dan's going to be joining us as well. So if you have questions about that, put them in the comments or somehow get your question to us so that we can discuss it. So why don't we, while we're bringing Dr. Dan in, why don't we show the second video that you all are sharing with us that you made during
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity, I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. Trust me, believe me, we're not gonna have another Tuskegee. This ain't eugenics, no way. Nobody getting away with hiding information today. Got the FDA, CDC, black doctors and experts for you and me. There's a whole lot of data for the world is free. Do me a favor, check it out and you'll see. I gotta give a shout out to all of those involved that's helping us get this problem solved. People wanna know, is the vaccine safe? It doesn't have anything to do with race. 9 out of 10 people won't get sick. That's 90% effective and legit. We gotta act now, please don't wait. Get the vaccine before it's too late, for real.
Right on. Those are so fun. Is Dr. Dan here with us? Let's invite Dr. Dan into the show. You guys just really kudos for using your creative and your scientific expertise to educate our community. Dr. Dan, did you see those videos?
I did. How y'all doing? I was jamming right there. I was like, it wasn't corny. You know, I'm a critic. I'm a hip hop fan too. So I was like, all right, it was dope. Was it all right? I can rock with that. I like it. Very good. Very good.
Welcome to the show, Dr. Dan. So Dr. Dan is one of our doctors on the Grapevine Health team. And Dr. Dan has been very busy during the pandemic, talking on the radio, on TV, on Clubhouse, like everywhere I go, I see Dr. Dan trying to educate people about the pandemic. So welcome, Dr. Dan. Anything you want to say before we jump into some of these questions about J&J?
Yeah, no, thank you for inviting me. And thanks to BlackDoctors.org and to my colleagues, Dr. Williams and Darryl and you, Dr. Patrick. It's an opportunity for us to pass the message and also to have the color, the face, the diversity. That's what we need. Yes, we also are smart too, and we can get the message out, and we understand this. So it's hard sometimes to get that message out, but once we get that platform, we can leverage our knowledge and also our relatability. I think that finding that right messenger is always key, and being able to break it down in digestible, understandable, and timely appropriate health information is what people need. That's what they need, so they can make their own decision. Anyway, I'm here.
So, Darryl, I have a question for you, though. Yesterday, or actually, the time is going very quickly. It was before yesterday when the news broke about the pause of the J&J vaccine. Were you hearing anything from the community about this?
No, but I'm scheduled to get my shots this Sunday coming, and it was the J&J because my wife, she wanted to get the one shot because she don't want to get 2 shots because, she's worried about the after effects and whatever like that. But then again, it's good to be close to the professionals and the doctors and the scientists. Dr. Williams, before the news even broke, Dr. Williams hit me. yo, we got to change the J&J shot. They're getting ready to put a hold on it, but we still going to give you the Pfizer shot. So it's all good. So don't be worried. So I really didn't have any anxiety after that. You know what I'm saying? So it's what's good for me is I'm in a good position because with all the misinformation and misunderstanding that's coming at me, I'm getting my information from the source. And even my family doctor, she told my wife that, yo, this COVID thing was one of the scariest things that she ever saw. And what helped me and my wife and my son, my son is a little younger, so he's more success, he'll fall into, nah, Dad, don't get the shot because of this. But to see the concern of my family doctor here in Wayne, New Jersey, Dr. Dean Jennings, she was like, yes, please get it. So that's the energy that I take for me to go publicly against all of this information and fear and facts. So since I'm in with the doctors and professionals, I'm getting the information that people need to hear. And it's my duty to share those experiences with the community to erase the doubt, to erase the anxiety and the fear. So I'm in a wonderful place. It's almost like I became DMC, the mighty king of rock, for a bigger reason than I could possibly comprehend. Adidas and walking this way is cool, but now, like you said at the beginning of this, Dr. Lisa, I'm using my talent and gift to serve.
Yeah, and thank you so much for that. I look forward to seeing what you come up with to answer people's questions about the J&J vaccine. So we've been diligently trying to move people along what I call the vaccine acceptance continuum. Because there's a lot of what I call noise out there about vaccine hesitancy. But when I'm on the street talking to people, I actually would find more people who were looking for the vaccine or wanting to get their questions answered than people who were saying, oh, no, I won't take the vaccine.
Sure.
And so my concern is that there's a lot of noise on social media about, okay, here we go. Now you see they're giving this vaccine to the Black people and it's not so good. And so I think one of the things I want to do tonight is to address the misinformation and talk about, okay, why did they pause and what's going on with that? It doesn't mean the vaccine does not work. We know this vaccine works. And even though the number, because in your video, you mentioned, 9 out of 10 people are going to be, going to do really well. And so people would say, well, Dr. Lisa, well, the J&J vaccine is not as good. In fact, that would have been my preference to get the Johnson & Johnson. Not only is it one shot, but it was tested against the mutations and the other vaccines weren't. And so I don't want people to walk away thinking this vaccine doesn't work. So Dr. Dan, why don't you help people understand why the pause was necessary, even though the vaccine works?
Yeah. So why? That's the $1 million question, right? In fact, actually, if you think about it, and just in the discussions I've had with some of the other physician scientists about this, they're like, why they stop it? I mean, it's going to send the wrong message. What's going on? I'm like, well, they found 6 cases, okay, out of 6.8 million that were vaccinated. I think now it's approaching 7.2 million vaccinated with the J&J vaccine, right? So when they did the numbers, you basically take that number of cases, the 6, and you divide that by the 6.8 million, you get this decimal number. That's the percent that you would see that actually had developed this. Less than 1%. It's like 0.0000 whatever. So people actually need to understand that. How do we break that down and make it make sense for people? We always say, make it make sense. So the point is, we've had these instances that happened overseas with the AstraZeneca vaccine. We already had people who were concerned about the vaccine. And then there were these cases of basically they were having a clot in the brain. And that's concerning. It's a very valid concern for those who actually experience it. So we're not trying to blow that off and say, don't worry about it. There's more to the story. But when you look at the instances of that versus some of the things we do, such as going on a flight, if you're pregnant, or if you're a smoker, or if you have some disease process where you have clots, there's certain things that put you at risk for clots that are greater greater, in addition to COVID-19 itself. So if you look at it, when it's less than 1% in that population that may have some type of clot in the brain, and you compare that to others who may have been admitted to the hospital with COVID-19, the disease, and they have about 20 to 40% chance of actually having a clot and dying in the ICU, in the intensive care unit. You have to kind of weigh your risk. You want to get the vaccine, or do you want to wait until you get COVID-19 disease and your chances of having a clot go way, way higher? So that's kind of how we balance it. So why did they pause? They paused because they wanted to make sure that the American public knew that, look, we heard y'all and we got eyes on this thing. Everybody's got eyes on it. So they're looking, even if it's that small of a case, we're going to scrutinize it and make sure we can give y'all the confidence that, look, we are looking out for this and we're going to figure out what's going on and make sure y'all feel safe. And that's pretty much what they did. And I think it's a good thing to show that the system is working and that they're actually scrutinizing and reviewing this information to make sure that everything's right. So that's how we got there.
And Dr. Williams, I mean, you talked about being a stroke doctor. And so here we have something right in your wheelhouse. So even before COVID, and you heard this like really, really small number, 6 out of, almost 7 million people with this clot issue. Even before COVID, like how often would you see something like that?
Well, I mean, I see stroke. I see go over 1,000 strokes a year. So I'm a biased. I see too many strokes. And
so it's usually a lot higher. Even
I mean, there's so many things. As Dr. Dan said, that there are many more serious risk factors for clots that I deal with. He mentioned some of them. Smoking, even oral contraceptive medication. I mean, there's so many other birth control pills. So there's so many other risk factors for clots that this is a really, really small, very tiny risk. But I do think the pause was important to do, and for the reasons Dr. Dan mentioned, because we always want to understand what the cause of the condition is and who is most at risk from this condition. AstraZeneca, for example, they found that this was mainly young people. So a lot of European countries are now only giving the AstraZeneca vaccine to people over the age of 65, for example, to older individuals. And so by understanding, what is it about these women? What is the common denominator? What is the mechanism of the condition? We see a condition very similar to what happened in these women. It was very similar to what happened in the AstraZeneca group with the blood clots. And I suspect that these types of vaccines, they're called adenoviral vector vaccines, I suspect that this very rare condition is kind of confined to these specific type of vaccines. And we do think that it's what we call an immune media, although we're still exploring that, but I do think it's probably what we call an immune mediated condition. And we've seen this type of condition in other conditions that I treat. And so I think my advice is for everyone to just recognize that this is a tiny, really microscopic 1 in a million risk. What we're doing is further identifying, even among those 1 in a million, who is even more at risk within that 1 in a million, so that we can now, if we do discover there's specific people that are more vulnerable to it, we can adjust the guidelines to say, okay, for this group of people, maybe we should use another type of vaccine. And so that is an overabundance of caution. But personally, I think the risk is very small. But my biggest concern is what it's done to anxiety, to the perception, to the people who are already saying, I'm not taking this vaccine. The damage it's done to the credibility of the vaccines is what we really need to repair, because the vaccines are safe. During the height of the pandemic, I was on the front lines for the whole time, for the whole period. I was running a COVID unit at Columbia, New York Presbyterian Hospital. And I saw a lot of, In half of my patients were required assisted breathing. But what I also saw was the widespread blood clots that are associated with COVID infection. So COVID infection, I saw the most devastating strokes as a result of COVID causing blood clots. In fact, when we're testing people for who have COVID infection, there is a panel of blood tests that we do to look for the tendency to clot. And most patients with COVID infection are at elevated risk for blood clots. And those blood clots are very dangerous, and they are much more common than what we're seeing with the J&J vaccine. So it's still so much better to get the vaccine than to put yourself at risk for COVID infection.
Yeah, and I just want to emphasize that this, all medications, all vaccines have side effects. It's really unfortunate that we saw these cases, these 6 women, but we're going to know more about what happened there. And that will allow us to continue giving this vaccine, because I want people to recognize these side effects don't mean the vaccine doesn't work. It does not prevent COVID. We know that. But Darryl, and then Dr. Dan, I wanted to just get you all's reaction to something Dr. Williams said, and it was related to the concern about the public perception. So now that it's been paused, I woke up, that morning I woke up and I saw on my Twitter feed someone saying, oh, now the fears of Black people have been realized, that this vaccine they're only giving to Black people is now like there's something wrong with it. But the truth is the J&J vaccine was never only given to Black people. So what are your thoughts about how this could have better been messaged to the public so that people wouldn't have these fears? Any recommendations, Darryl, and then Dr. Dan?
How to alleviate this confusion?
Right. How should we have better communicated this information to the public?
Well, a lot of times the first place people get their information from is the major media channels. So I think it's up to our local information sources to be on the front line. People that our communities are familiar with and who people who trust. But a lot of times the necessary sources, especially in the media, who have the opportunity to destroy the mass influence of misinformation and anxiety and fear, they don't address it. A lot of the things most of the normal people look at is Entertainment Tonight and Access Hollywood and stuff on MTV. And those media outlets who have the attention, a lot of it with these reality shows, these people are glued to that. Those are the places that when a commercial comes on, it should be information about what's going on with. But they don't do that. They still so busy talking about who's dating who and who got in trouble and who got arrested. And even an outlet like TMZ, they should shut down all that gossip stuff and they do a good job of putting information out there. But what if TMZ got on board with you doctors and every second, why don't they have discussions about what we're doing here? So that's what we're up against. I suggest that the people that write checks for these corporations and control outside of CNN and Fox, because people don't trust CNN, people don't trust Fox. It's our locals, the Channel 5s and the Channel 9s and the News 12s. And when Access Hollywood is in the primetime hours, to answer your question, the primetime hours should be utilized to supply the people in all communities the necessary information during a pandemic, a disaster or issue, but they don't. So It's up to us to do things like this across the board And I'm just pleading with them. They should make it mandatory. The CEOs of these companies, they should devote 6 p.m. to 9 p.m. to that information, but they don't. See, that's what we're up against. That's why Dr. Williams is saying, let's utilize this hip hop things, because it's something people will always listen to.
They need to show some of your raps. Before we go to Dr. Dan to answer this question, I just want to remind people, if you have questions about the J&J vaccine and the pause or anything else related to what we've been talking about tonight, hip hop and public health and the need for relatable messaging to transmit health information, be sure and leave your comments or questions so we can ask them on the show in the last few minutes we have. So, Dr. Dan, what's your response to this? What could have been done better to communicate this information without stoking all the fear and now the distrust of the J&J vaccine?
I mean, it's always difficult. And to Darryl's point, I mean, we have to meet people where they are. Executives of the broadcasting channels really need to do some soul searching on that. I understand it. There's the marketing issue behind that. They need eyeballs, right? They need people glued to it. And then the media of different outlets basically sensationalize the thing because they want people to look at it. And then the advertisers are kind of supporting that whole process. So when there's money, you know, there's always some motivation there. So it's understanding the brand and actually trying to figure out how to repackage the message while engaging the community. So it might not be 3 hours, but if there's an hour dedicated that you actually will get eyeballs. And we know this, Dr. Patrick, because we've been on some of our social media apps and even on these channels, people actually are concerned. So they're going to tune in. And it's all about the messenger again. So if you target the population, you talked about local media, local news, that's the channel. So they listen to them. They not the syndicated big broadcasting stations, but they'll still listen to those too. But there's certain ones that they find more credible that they can relate to. It's in my community. We say in disasters are local. So you got to get the local talent and to the local messenger. So what you're doing, Dr. Lisa in the street, I mean, is what it is. What Dr. Williams is doing. What Darryl's doing, what I'm doing, that's what we're doing. We're engaging, we're going to where they are. And that's like the military style, where we go in there and we got to go in. It's almost like guerrilla warfare. We really got to get into the communities, go to where the battle is and go help out. That's what we're supposed to do.
Yeah, absolutely. I mentioned at the top of the show, we were going to end the show with the wrap. I was going to put Darryl on the spot. To see, so you can start thinking about that because we're coming to the close of the show, and I was hoping you could send us out with some sort of hip hop public health message. That would be great.
Okay.
So the last question I have though is just sort of on a practical level. We still see, and this is about young people. We still see a lot of young people who are reluctant, disinterested in taking the vaccine. And I've had all sorts of reasons. Number one, well, I had COVID and I didn't get that sick. Or is it really real? Or I don't know anybody who had COVID. And so we can talk about the need for community all we want, but I think it's falling on deaf ears for a lot of young people. So that's my last question for all of you. Just what is your advice about how we reach young people so that they know they do have a role to play in ending the pandemic? Because we can't get out of this pandemic without their help. But so many of them feel like this is not affecting them, and so they're not interested. So why don't we start with you, Dr. Williams, then Dan, and then Dr. Dan, and then we'll end with you, Darryl.
So I can say that, so Hip Hop Public Health, we have, just as an example, we have a partnership with an incredible organization called Heart Smiles in Baltimore. And Heart Smiles is an organization that works, in the streets of Baltimore, and they get a lot of young people and they put them through leadership training. And these are young kids from really, really tough backgrounds and have had really, really tough lives. And it's just incredible. It was an incredible organization. I encourage you to look them up. Heart Smiles in Baltimore. And so, these are teenagers, all the way up to young people in their early 20s. And so we have been working with them as an organization. And one of the things about these young people is that there are influencers among them, right? So if you identify the influences among who is the leader of the pack, who are the people, the other young people, who are the peer leaders, and it's one thing. It's something that we've done throughout public health. There are different approaches that we use for different age groups. We call it audience segmentation, and it's important with young people, depending on the age, and with the particular audience that we're talking about, peer-based interventions, peer-to-peer interventions is really what they list. Who is from within their ranks? Who's the leader? Who's the influencer that can take the message and start influencing? So this is what Heart Smiles does, and we've identified a group of incredible young people in Heart Smiles, and we've turned them into vaccine champions. These are young elders, one of them, and these are real. I mean, these young people are like, these guys have been through a lot, and they have a lot of capital in their local environment, in local community. They have a lot of capital, young people, and we've turned them into vaccine champions. And they are now the ones talking to their own people in their own local communities. And you win one person, you turn that person into a believer. That person goes on to win another one, and then you got the whole block, and then you get that block, and then you got the neighborhood, and then you move to the district, and then you move to the city, etc. So it's you have to have boots on the ground, and you have to win these young people and create these champions that can do the peer-to-peer influencing. And we've seen that model work. We've seen it in HIV. We have a very successful peer-based models with HIV that has shown tremendous success. And it's these types of approaches that we need for our young people, identifying the influences, getting down with them right there in their communities, on their street, in their block, creating champions out of them, and having them partner with us, to help us with the work. And this is one of the things that we're doing with Heart Smiles in Baltimore, and it's just one model that we know works.
All right. Dr. Dan, what are your thoughts? How do we reach young people?
So, being someone in the DMV area, so definitely you got to tap in with Baltimore. It's right up the street. What I would say is, from an emergency standpoint, I see them come into the emergency department. So when I see clinical patients having these problems, adolescents, teens, we have to get to them by sharing those stories and helping them understand also what is SARS-CoV, the infection, versus COVID, the disease. Just because they had a little sniffle or asymptomatic disease, meaning they didn't have any symptoms and we swabbed their nose, that doesn't mean they really had COVID, the disease, and they didn't have any clots and they did fine. So they need to understand that. So there's some education around that needs to be done. In addition, their favorite stars, athletes, even some on their teams, on the football teams, on different athletic outlets, have had heart problems, literally heart palpitations and fatigue. They've had some symptoms of long COVID. So those are the stories they need to hear and they need to be aware of, not as a fearmonger, but just to raise your awareness. And it's that we don't even know the long-term effects that may happen after that, especially in someone who was in shape and now they can't even do this stuff. There was one I just saw on IG that's an athlete in the NBA. I don't remember his name, but the bottom line was he's now having to use an inhaler all the time. It's real public. So this was somebody who was in tip-top shape, but got the infection and got COVID, the disease, and now is using an inhaler. So those are the stories I think that people need to know so they're aware, and then they can probably better prepare themselves.
Yeah, thank you all so much for being here. So Darryl DMC, we have 1 minute left. Do you want to share something with us? And I also just want to let you know, you all are getting a lot of love in the chat, especially from Mr. Timo T, who I hope you can follow up with because he wants some advice from you. In the few seconds we have remaining, you want to send us out with a hopeful health message.
Okay, so we're all in this together. And it's all of us to work with the people who are put in our universe to save lives. So I'm just an example of what the doctors are, what the people with the right information that is detrimental to the survival of our communities. But we must educate the young people while they are young so they grow into those powerful, positive, productive adults. So I'm going to end with this. I'm locked up in this world and I'm doing a bid. So I'm going to spend my time trying to help these kids. They said Rocket Death Rhyme are already dead, almost committed suicide, but I decided to live. I created deep tracks with atomic hooks. They call me Little Darryl Mack with the comic books. There is no justice if there is no peace. And the gods made me to defeat the beast. When you see me in a battle, they always run. And if you're thinking Darryl's something, you should see my son. I fight real hard for all the kids in the schools, in the group homes, in the orphanage. Is it a very hard job? Of course it is. Did I speak to God? Of course I did. Deliver my children, what she told me. The initials of your name will be DMC. There's a very good reason I made you king, because all the little kids are really kings and queens. You're a superhero. This is true. So let the kids know that dreams do come true. Let's rock. The children, they need us now. Everybody out there gotta help me out. Let's rock. The children, they need us now. Everybody out there gotta help me out. It's for the kids.
Ooh.
Thank you.
Fire,
Thank you so
fire,
much.
fire,
Thank you.
What's
All
up?
right.
What's up, D?
Thank you, everybody, for tuning in. Thank you, Dr. Williams, Dr. Dan, and Darryl DMC. And you guys, we will see you next week for Straight Talk with Dr. Lisa. Good night.
Thank you, Dr. Lisa.
Right.
Thank you, Doc.